Health disparities are defined by the CDC as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. People with disabilities experience many disparities across a variety of health and mental health care settings. Let's explore what some of those are and what steps can be taken to improve upon current conditions. Frequent mental distress can be defined as having not good mental health for 14 or more days of the month. About 26% of individuals without a disability reported having frequent mental distress, while 56% of people with a disability noted that they experienced this. That's a 30% difference. Data has found that individuals with disabilities also experience more chronic health conditions, 80%, than those without disabilities, 45.4%. People with disabilities in urban and rural regions were found to have a similar prevalence of chronic health conditions such as diabetes, depression, and arthritis. However, healthcare resources and services are typically less available to individuals in rural communities. This can be especially true for care that is accessible for people with disabilities. So, what can we do to decrease health disparities and increase accessibility to high-quality healthcare? An important step for decreasing health disparities is to shift the focus away from a mindset of curing disease to one of promoting overall well-being. Steering health officials in programs to encourage holistic and well-rounded care can be vital for bettering health equality. Another step we can take is engaging in concerted efforts to include people with disabilities in statewide programming to increase accessibility. Directly communicating with health workers and other community groups can help leaders tailor resources to the specific needs of each local area. Lastly, designing programs and material with accessible delivery methods in mind will allow more people with disabilities to engage in learning. Online programs and modules that support well-being across chronic health conditions and mental health concerns can be created and utilized by individuals across the country. Data used in this project was from the CDC's Behavioral Risk Factor Surveillance System surveys. More information about this project can be found on Utah State University's Institute for Disability Research Policy and Practice website. This project is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services, or HHS, as part of a financial assistance award totaling $900,000, with 100% funded by the CDC and HHS. Funding is facilitated by the Association of State and Territorial Health Officials and the Association of University Centers on Disabilities.